Hi there, this is Nursing Education Videos. Today I will be going over Deep Vein Thrombosis, DVT, NCLEX review on registerednursern.com. I will be reading the review notes. I hope this information is helpful for your learning. And all credit for this information that I am reading goes to Sarah at registerednursern.com. Again, all credit for the information that I am reading goes to Sarah at registerednursern.com. Please refer to the websites in the description box for all credit and information. Links for the information will be included in the description box. Deep Vein Thrombosis, DVT, NCLEX review for nursing students. A deep vein thrombosis is a type of venous thromboembolism. Acronym is VTE. It is important that you're familiar with the signs and symptoms, preventative measures, treatment, and pathophysiology for a DVT. What is it? It's the formation of a clot within a deep vein. It's a type of venous thromboembolism, which is a blood clot that starts in the vein. The other type of VTE is a pulmonary embolism, which is where a deep vein thrombosis breaks off within the vein and goes to the lungs. A pulmonary embolism is a risk from the development of a DVT. What veins are most susceptible for a DVT? The veins located in the pelvis, lower leg, such as the calf, and thighs. This includes peroneal and posterior tibial in the calves, found in the lower leg, as well as the popliteal and superficial femoral, found in the thighs. DVTs tend to occur in the lower extremities, which are the legs, but can occur in the upper extremities as well. However, DVTs in the lower extremities tend to have a higher chance of breaking off and turning into a PE, which is pulmonary embolism. What factors play a role in the development of a DVT? To answer that question, we must review Virchow's triad. Virchow's triad gives us three main factors that can lead to blood clot formation within a vein. Remember, there are three factors, hence why it's called a triad. Anyone can develop a deep vein thrombosis, especially if these risk factors are present. Remember the mnemonic SHE, S-H-E. S is for stasis of venous circulation. Blood cannot just hang out and become static within a vessel. If it does this, the blood will start to clump up due to the presence of platelets and will form a clot. The venous system is responsible for taking deoxygenated blood back to the heart. Therefore, the blood has to flow back to the heart via the veins, and it does this with the assistance of healthy vein valves and the muscles within the extremity. If the veins valves are damaged or the muscles aren't working or being used, blood isn't going to flow back very well and a blood clot can develop. What are some conditions that cause stasis of blood flow? Being immobilized, varicose veins, surgery such as the hip or knee, traveling for long hours without moving extremities, obstruction due to late pregnancy or obesity, heart failure such as left ventricular dysfunction, and atrial fibrillation. H for hypercoagulability. Let the name of this factor help you. Hyper means increase or high, and coagule refers to the coagulation process in the body, hence forming a clot. Therefore, the patient has a high risk of forming a blood clot. The main reason for this is due to a disease process, but it can be due to other reasons. Note, this list is not a complete list. What are some conditions that cause an increased risk of forming a clot within the vessel? The risks are cancer, severe illness such as sepsis, dehydration, usage of estrogen such as birth control, heparin-induced thrombocytopenia, acronym is HIT, as well as postpartum period. And then E stands for endothelial damage to the vein. This endothelial is a layer of cells that lines the inside of the vein. Damage to this layer can be from a direct or indirect cause, but regardless, it stimulates platelets and the coagulation process. So think of anything that damages the lining inside the vessel. What are some conditions that cause damage to the endothelial lining? IV drug usage, also venipuncture, drawing blood from a vein, indwelling devices such as central line catheters, IV lines or heart valves, etc., medications that are damaging to the vein, and trauma or injury to the vessel, such as surgery. How does a clot form and what substances are involved? Regardless of the factors contributing to the blood clot, as identified by Virchow's triad, platelets are involved. The platelets start to collect at the edges of the vessel, usually within the cusps of the vein's valve. Platelets normally help create a seal to stop the bleeding. So, when they start to work within the vessel, it recruits other chemicals called clotting factors. Clotting factors cause fibrin to be created. Fibrin causes the big problem in terms of a clot developing because fibrin is like strands of mesh. This causes white blood cells, red blood cells, and platelets to stick together within the vein. This forms a clot and it continues to grow, which can eventually break off and enter venous circulation. So, we've seen how a clot forms. Now, let's talk about what you can see in your patient that may have a deep vein thrombosis. So, signs and symptoms of a deep vein thrombosis: redness, swelling, very warm, pain, and Hohmann's sign. The Hohmann sign is not reliable for detecting a DVT because of false positives, but know for exams how to elicit a response. Extend the patient's leg and manually dorsiflex the patient's foot. Bend it up towards the shin. If it causes the patient pain, it is considered a positive Hohmann's sign. Nursing interventions for DVT. So the DVT can be diagnosed with an ultrasound. Also can be diagnosed via D-dimer, which is also called fibrin degradation fragment. This is a blood test that assesses for fibrin degradation fragment. D-dimer, it's a fibrin degradation product. So D-dimer is a fibrin degradation fragment. It's used to diagnose blood clots or disseminated intravascular coagulation. The acronym is DIC. This is a protein fragment that hangs out in the blood when a clot breaks down. So this means a clot has formed and has started to break down. A D-dimer doesn't tell us where the clot is located, so it will need to be further investigated by the MD. Also, a positive result doesn't necessarily mean the patient has a clot, because some disease processes can cause a false positive. Example, liver disease, myocardial infarction, surgery such as the heart, and cancer and pregnancy. A normal D-dimer D-dimer can be reported in fibrinogen equivalent units, FEU, or D-dimer units, acronym DDU. Normal levels is less than 500 nanograms per milliliter of FEU, which is the fibrinogen equivalent units, or less than 250 nanograms per liter of D-dimer units. Prevention. It is very simple but so beneficial. Nurses play a huge role with this. Assess for the signs and symptoms and risk factors above and take precautions with prevention. Application and regular usage of pneumatic compression devices like SCDs, which are sequential compression device per MD order. These devices wrap around the legs and inflate and deflate to help move blood. So it says to inflate and deflate to help move blood flow. It is similar to walking. However, they must fit properly. They're not to be applied to the extremity that has an active deep vein thrombosis, which can lead to dislodgement. Make sure the patient is wearing them while sitting or in bed. Take them off when the patient is walking. Make sure they're plugged in and that they're actually inflating and deflating. Ask the patient if it's working correctly. These devices can come unplugged from wall and it can quit working. Also, make sure they are changed and cleaned regularly. They can become sweaty and smelly. Patient needs to be ambulating daily and out of the bed with all meals, if possible. Teach patient to perform exercises by flexing and extending feet and legs every hour while awake. Compression stockings per MD order provides a specific amount of compression to help decrease the risk of blood clot development. Prophylactic medications are usually given after surgery, which is post-op, especially joint replacement surgery like the hip, for example, enoxaparin, which is a subcutaneous injection. If the patient has a DVT, the mnemonic is deep clot. D for don't rub or massage affected extremity. It can dislodge the clot. E for elevate the affected extremity above the heart level. It promotes blood return and decreases swelling. E for ensure bed rest. P for pharmacological measures include anticoagulants. The anticoagulants do not break up the clot, but helps prevent new ones from developing and from getting bigger. One of the anticoagulants is heparin, which is an indirect thrombin inhibitor. It enhances the activity of antithrombin 3, which will inhibit thrombin and the conversion of fibrinogen to fibrin. It acts fast, given IV or subcutaneously. It is weight-based. Monitor APTT, which is the activated partial thromboplastin time, to be 1.5 to 2.5 times normal ranges. Greater than 80 seconds is a risk for bleeding, where the dose would probably be decreased. Or the writing here is greater than 80 seconds, risk for bleeding, dose decreased. Less than 60 seconds, not therapeutic, risk for clots and may need dosage increased. Used in combination with warfarin until INR, which is the international normalized ratio, is therapeutic, and then heparin is discontinued. And the antidote for heparin is protamine sulfate. It is the international normalized ratio, yes. That's what INR stands for. Warfarin. It is a vitamin K antagonist. Since it's a vitamin K antagonist, it will work to inhibit clotting factors from using vitamin K. It has a slow onset. It takes about 3 to 5 days for a patient to become therapeutic. It is taken orally. Monitor patient's PT/INR. PT stands for prothrombin time. Therapeutic INR is 2 to 3. Less than 2 is not therapeutic, and greater than 3 is at risk for bleeding. The antidote for warfarin is vitamin K. Thrombolytics. They are catheter-directed thrombolysis with TPA, clot-busting agent delivered directly to the clot. Watch out for bleeding. So it's a catheter-directed thrombolysis with TPA, which is a clot-busting agent delivered directly to the clot. So as a nurse, we need to watch out for bleeding. Filter. An IVC filter. It's a small metal device placed in the inferior vena cava to prevent blood clots from entering the heart and lungs. So IVC would stand for inferior vena cava. Many times this is placed for patients who can't take anticoagulants. And then C for compresses. Warm/moist, which helps pain and circulation. L for leg circumference measurement, which is the calf. Measure about 10 centimeter or 4 inches below tibial tuberosity. Watch out for a 3 centimeter circumference or more measurement when compared to the non-affected calf. Observe for signs and symptoms for pulmonary embolism, which are sudden shortness of breath, decreased oxygen saturation, fast heart rate, chest pain, very anxious, sweating, and coughing. T for tight compression stockings, thigh or knee-high compression per MD order, helps promote blood flow and decreases swelling. Change regularly and show patient how to apply. It is fitted and applied properly as prescribed. Compression stockings may prevent PTS, which is post-thrombotic syndrome, which happens sometimes after the development of a DVT. So post-thrombotic syndrome is PTS. This is because vein valves and walls became damaged due to the clot. Blood doesn't flow in the right directions, which should be going back to the heart. Now, test your knowledge by taking the Deep Vein Thrombosis NCLEX questions quiz on registerednursern.com. So there's also references for this information. The reference is Diagnosis and Treatment of Venous Thromboembolism, CDC, 2019, retrieved 1 November 2019 from www.cdc.gov/ncbb/diagnosis/treatment.html. And then the next reference is Venous Thromboembolism, National Heart, Lung, Heart, and Blood Institute, NHLBI, retrieved 1 November 2019 from www.NHLBI.NIH.gov/VENOUS-THROMBOEMBOLISM. The next one is What is venous thromboembolism? CDC, retrieved 1 November 2019 from www.cdc.gov /ncb/ddd/dvt/facts.html. Thank you for listening. I hope this information was helpful and engaging. Please feel free to subscribe and click the like button, and go to registerednursern.com for more information and check out their YouTube channel. Thank you again. Hope you have a great day.